Joining us now to talk about extending care through telemedicine and remote monitoring, please welcome Ryan Howard, founder and CEO 100+, Dr. Roy Schoenberg, president and CEO of Amwell, and moderator Dr. Mehmet Oz, Emmy Award-winning host of The Dr. Oz Show and cardiothoracic surgeon.
Half of the world's population lacks access to essential healthcare services. Telehealth exploded during the pandemic. Now we hear from two experts who have deployed it to expand access, reduce costs, and improve care for chronically ill patients. I'm joined now with Dr. Roy Schoenberg of Amwell and Ryan Howard of 100+. It's great to be here with both of you. Let me start with you. The pandemic changed healthcare as we know it. I think we're all sort of grappling with what that means, what the patients and providers want from care as we move forward, and where do virtual care technologies fit in?
Well, first of all, thank you for having me. And I think, the expectation is, rightfully so, that healthcare will join, the fate of other industries that embrace technology as a way to do their business. Retail and banking and entertainment, the Netflix, the Ubers of the world and everything else. We have seen during the pandemic that healthcare can travel over technology. The debate about whether that is safe or helpful and what its role is in healthcare is literally overnight over. And I think we all have an expectation that the future of our healthcare experience will blend the delivery of healthcare over technology to where we are. And I think that's, if there's a silver lining, it's hard to find one during the pandemic, but we have definitely moved a generation forward in our understanding on how these technologies can make our life much, much better.
Yeah, Dr. Oz, I agree with Roy. I think that the emergence of telemedicine has been coming forth for over a decade now. It's been incredibly slow to build comfort with the doctors, to get them to adopt technology within the practice, and also to ensure that the patient is comfortable over the connection and using the new technology as well. And to Roy's point, the silver lining is that technology was at least accelerated by 5 years, probably 10 years during the pandemic. So effectively, this force, because patients were no longer comfortable going into the doctor's office, and the doctor's office, which was previously a safe place to go, was arguably an infectious environment during the pandemic, the doctors had to adopt new technology and the patients had to also do that as well. And so we see a lot more comfort, especially among seniors who are generally not as tech savvy as the younger generation. And we've seen a lot of pickup of these products during the pandemic.
So let's get into the details on that. What kinds of at-home monitors are in use right now? Can you give us some concrete examples, things that can happen at home that used to always happen in the doctor's office? And can monitoring really improve outcomes?
Yeah, so what we see is that the product we offer has a number of different pieces of hardware that are FDA approved. So blood pressure, blood sugar, weight scales, and then thermometers and O2 saturation. And these are obviously for conditions like hypertension, obesity, CHF. So the ability to deploy these devices because of the emergence of IoT, meaning that these devices are cell-enabled. When they land at a patient's house, they don't require smartphones and Bluetooth and apps to be downloaded. They seamlessly send data on a daily basis to the practitioner and remind the patient to be compliant as well. This allows doctors to, real-time look across their entire patient population. And the systems they have population health management. So they're identifying the most at-risk patients based on American Heart Association, American Diabetes Association, and CDC guidelines. So instead of looking across just 1,000 patients and seeing a lot of data, it's segmenting the ones with the highest risk so the practitioner can reach out and engage. So these are pragmatic applications that are happening on hundreds of thousands of patients in the US today.
How long do you think until we're going to have hard data showing that these early warning systems can affect outcomes? Or do we have some already?
Roy, do you want to take that? Or I'm happy to as well.
No, I was going to comment on something else. I mean, I fully agree with you. There's truly an explosion in sensors and detectors and all of these different devices in the home that can help us understand what's going on with the patient. I think sometimes, we get distracted by shiny objects of technology and miss the story. The question is, to what purpose? So yeah, some glucometers are better than others and blood pressure cuffs and everything else. I think we're beginning to see, we're coming out of the woodwork and are beginning to see the opening where the purpose of all of these is if they work in conjunction to allow patients to stay home. Mm-hmm. And be reassured that is not a negligence in terms of their medical care, but rather a place that they can be safe, that they can be monitored, and that the cavalry of healthcare services can come in case something goes the wrong way. But that is a huge, huge promise, because it means that as people, we can stay where we want to be. Nobody wants to be sucked into the belly of the beast of healthcare, into a skilled nursing facility or a clinic or a hospital or whatever it is. It's the combination of technologies, sensors, remote patient monitoring, telehealth technologies, and a lot of other services around them that are beginning to come up with a good story that will allow us to stay home, which is the purpose. And I think that's an amazing change in how our life is going to look like in the next literally decade or so.
Yeah, I think that's a tremendous point, Roy. So Dr. Oz, the pandemic catalyzed technology, the adoption and comfort of utilizing the technology. The reality is that life is going back to the way it used to be, right? People are taking their mask off and things will resume. And the reality is that with senior citizens in particular, who were the most vulnerable population during the pandemic, they, as Roy mentioned, the staying home issue is a problem, and getting healthcare at home, that bridge is really critical. Now, without a pandemic, senior citizens, they're usually making about $17,000 a year on Social Security. So they're not using Uber or Lyft. And so healthcare for them is a binary, it's a 0 or 1. They're either, our data shows the average senior citizen with three chronic conditions, right? They are not going to the doctor on a monthly basis as they should be. They usually show up once a year. So they're using, obviously, the hospital and the ER room for primary care. And this is, the difference between a $50 visit and a $50,000 visit. And so the ability to give access to that person who simply can't afford to even get to the practice and get to the doctor, this technology enables that.
I gotta say, the field moving so quickly, it's good to have two world experts speaking to it. So I want to try to understand a bit more about the evolution. And let's start with telehealth. So I know that it was sort of moving along. I've been following this space for a while. We're seeing this tool provide urgent care visits to actually used to be urgent care. Now it's not even that anymore. Now it's just regular care for chronically ill patients. What are the most impactful telehealth use cases that you're seeing, Roy?
Yeah, I think you're exactly right. I mean, if we had this conversation, 3 or 4 years ago, telehealth was urgent care apps and telestroke. These are kind of the big stories of telehealth. And today, the reality is that, where I come from, we operate over 150 different types of telehealth. So the world has changed, very dramatically. I think the biggest difference, and we've actually seen this during COVID, is that while there was a kind of a big hike during COVID of people who were using telehealth for urgent care because they were locked in their homes, there were no outpatient clinics, no retail clinics, PCP offices were closed. Nobody wanted to be in an ER during the pandemic. So people were using it for urgent care. But then about a month later, we started seeing a completely different revolution kind of imposed over that, where clinicians started embracing telehealth to catch up with the patients that they had a responsibility for. And these are not urgent care patients. It wasn't even used to generate a diagnosis. They know those patients for years with diabetes and heart failure and everything else. And they started using telehealth regularly to manage those patients who are homebound. The first revolution of urgent care came and kind of went, with the relaxing rules of COVID. That other revolution that almost you couldn't see is now by far the biggest wave that we see that is redefining telehealth.
And I look at some of the hard data here. Let me just present something from Insider Intelligence. Estimated 30 million US patients, 30 million will use remote patient monitoring tools by 2024. That's about a 28% growth from today. Should the growth be even higher than that? Ryan, take that question. Also, do you think it can continue after we conquer COVID-19, or just a bit of a blip and we'll sort of go back down towards where we were in 2019?
Yeah, look, I think that, to be frank, I think that there will be a slight drop in the sense that people like to go see their practitioner in person. So I think that obviously some things will return to normal. The other reality is that some things cannot be done remotely. So if you need diagnostics done, if you need lab tests done, remotely makes that really, really challenging. Not impossible, but more challenging. There's not a lot of really streamlined workflows for that today. But the net is that the telemedicine traditionally has been for these kind of small acute events, a cold, more superficial things. And with remote patient monitoring is the data, right? And without data during the visit, without blood pressure and other critical vitals, the visit just becomes a FaceTime with grandma. And so effectively, we definitely see that, the tools have been implemented, tools like American Well, which Roy runs. And so the doctors have the tools are not going away, and the comfort has been built with the patients as well. Now, beyond that, what we've seen is that our program that we serve is a Medicare program. And since 2019, it's expanded from Medicare fee-for-service to Medicare Advantage to about half of the states cover remote patient monitoring for Medicaid as well. Over the last few months, 17 states have mandated that remote patient monitoring is now reimbursed by private payers. That means anyone on the call right now that's under 65 that has a chronic condition will be served and reimbursed for remote patient monitoring as well. So the market's tremendous. The market cap's obviously significant. And then, it really maps to chronic conditions. And like Roy said, the ability to access these patients remotely, because it's the in-between those, that 10-month period where a patient's not having a visit is where the episodic event happens. So bridging that gap is what RPM does. And employers behind this, obviously the payers are, and now the practitioners and patients are as well.
RPM being remote patient monitoring, it's become such a popular phrase that it's become one of those largos that doctors speak with. Roy, it seems like we've got the awareness hurdle jumped. So people now have an understanding of what telemedicine and telehealth can provide to them. What's needed going forward to make it a more sustainable part of care delivery? And what are the biggest challenges you're going to have to overcome in Amwell?
Yeah, it's interesting that we're sitting here and now saying, licensure is not going to be an issue anymore and reimbursement is going to be fine and all of that kind of stuff. And as you said, awareness is in a good place. To me, I think the biggest hurdle that we have is that we're still in the wrong mindset about telehealth. We still think of telehealth as a replacement of an office visit. So instead of going to the physical office, take the bus and get there and sit and wait and see the doctor, you're going to use technology to do so. And I think that is something that has to change, because we fundamentally underestimate what telehealth is going to do to the practice of medicine. We have to rethink from the ground up, how do we surround cancer patients? How do we allow ourselves to walk in and out of their environment and give them the support and all of the disciplines that need to participate in making sure that they can battle chemotherapy and the struggles that they have? How do we use telehealth to democratize the availability of healthcare in places around the country or places around the world that is not physically available? How do we rethink about services that can allow people to gracefully age in their home, which includes a lot of sensors and remote patient monitoring? Telehealth is not a replacement. It's not another channel by which the same office visit would happen. It is an instrument of change to the practice of medicine and to the availability of healthcare services. And the moment that people will step back and start thinking about this way, we're going to see the same change as the change that Amazon introduced to retail. It wasn't just the ability to get a book online. It changed anything and everything that we know about how goods travel from the people who make them to the people that use them. That's right ahead of us.
Yeah. And Ryan, following up from that, what should we expect to see in this space as we move forward in, let's say, the next 5 years? And to help me understand and everyone understand, what happened in 2020 that's going to facilitate what you predict?
Yeah, I think the big point that I've been stuck on is obviously comfort, right? The adoption of the tools aren't going to go away. And now that that's happening, expansion within a practice's patient population. I think what will change, Mehmet, is that most of the devices today, while they are cellular and connected, which is fantastic, there's still a barrier to entry, meaning the patient has to go to that device on a daily basis. And, stepping on a scale is a relatively low barrier to entry, but there's meaningful behavior change there. Taking blood glucose or checking your blood pressure when you previously weren't on a daily basis is meaningful change, especially for a senior citizen. Passive monitoring for many vitals and many biometrics will be the next step. It's probably still a few years off. Most of the CGM, constant glucose monitoring out there is invasive, right? It's basically a piece of technology that goes into the arm and penetrates the skin. And so effectively, we are seeing technologies on the wrist and other parts of the body that are collecting blood pressure, blood glucose, and other vitals in perpetuity. And the ability to do that and make that so the patient's persistently participating in the program without any patient intervention is going to be really critical and will change the dimension of healthcare as well.
Yeah, Roy and Ryan, thanks for all these great insights. I think you'll actually be getting all the data that we make decisions on. It won't be looking at studies from 10 years ago. It'll be prospectively gathered data that drives decisions tomorrow morning. God bless you both. Godspeed on all your great work. Keep making the future brighter for all of us.
Thank you.
Terrific. Thanks for having us.